Hi, I'm Dr. Sims. I've been with Baylor Scott White since 2019. I'm a physical medicine and rehabilitation physician, and today I'm going to talk with you about some back pain. Before we get too far in depth into this presentation, I'd like to take a step back and talk to you a little bit about the anatomy of your own spine. The bones of the spine provide the structural support for your back. There's 24 vertebrae in total, 7 cervical in the neck, 12 thoracic in the chest and upper back, and 5 lumbar vertebrae, and eventually a tailbone. The joints in the spine help to control the movement of the spine. These are the facet joints, otherwise known as the knuckle joints of the spine. The discs are shock absorbers. They help to separate vertebrae, allow for space in between each of the vertebrae that support the weight of the body, and they allow the vertebrae to bend and twist naturally. The muscles help to move the spine. They contract and help the body to move. The most important of these in the spine is probably the paraspinal muscles. Those are the muscles directly next to the spine. The ligaments are tough, non-elastic bands that help to hold the bones together. And the nerves provide the energy to make the muscles work. They all come from the spinal cord and go to their eventual destination and provide sensation and movement to the body. So I want to talk a little bit too about some common back disorders, whether that's acute strains or sprains of the muscles that support your spine from lifting something too heavy or inappropriately, whether that's muscle spasm or tightness and imbalance that come with pain, with muscles that tighten up and seize and cause pain, whether that's from a disc, like we talked about previously, the discs that help to support the vertebrae. If they herniate, which is that they move to a place in your body where they shouldn't be as they push out because of the pressure on the spine, whether that's degenerative disc disease or osteoarthritis, the discs and the bones of the body will break down with time and age and general wear and tear, or whether that's radiculopathy. That's kind of a fancy doctor word for saying a pinched nerve. And that nerve that gets pinched as it's leaving the spine can cause pain down the leg, down the arm. Wherever that nerve goes is where that pain is going to be. So if you do have back pain, what is kind of the general outcome? How often do these patients get better? How often do people who have back pain get better? The truth is, the vast majority of people, if we're talking about one single back pain event, the vast majority will improve. 70% will improve within 2 weeks, usually by limiting the offending activities or the things that cause you pain in the first place. 90% will improve within 6 weeks, and 3% don't improve after those 6 weeks. So if it does get better, like we're saying it does it come back? The truth is, yeah, it can, and often does. So if you'll look at the diagram on the slide here, you'll see that there's a cycle that we can get into that cause worsened back pain. Typically you have an injury, a back issue that we initially have a problem with. That causes pain and stiffness because we don't move, because it hurts. So if it hurts, we just don't do that. And that causes the muscles to get stiffer. Well, when you don't move a muscle and you don't use it, that muscle gets weak. And all of the muscles that support the spine, your paraspinals, your quadratus lumborum, all of the hip flexors and hip extenders, they all get weak if we don't move our back and we lay around because our back hurts and everything gets weaker. Well, then the next time that we have another injury, or if we step off a curb too quickly or bend down too quickly to pick something up, when typically the muscles that help to support the spine would have been able to absorb that shock and not cause injury, well, this time it caused worsened injury because all of those muscles that support the spine are weak. And then we're back at the beginning. We're back at another issue, and we're back into this cycle of pain that we can't seem to get out of. And that's what we have to do. We have to break the cycle. So if we're not able to break the cycle, if we're having continued pain in our back, what are some of the other causes from that? Poor overall fitness is probably the biggest. That means loss of flexibility, loss of strength of the muscles that we talked about to help support the spine, or like a vast majority of Americans, we're carrying too much weight. A pound on you is like 5 pounds on your spine, and the more weight that we carry, the more likely we are to have back injuries. Also can be related to poor body mechanics, lifting things inappropriately. If you work in an environment that you are lifting regularly at work, it's very important that you know exactly how to lift appropriately and safely to limit back injuries. And the other part of that is poor ergonomics. Say you're at a desk job all day long. Is your desk appropriate? Are you able to have a standing desk so that you can get off your backside, literally, and stand up and move? And also that when you are sitting at the desk, that you're able to have good ergonomics and have the desk at the computer screen at eye level and limit poor ergonomics. So an ounce of prevention is worth a pound of cure, and this is true with back pain as well. The more that we can do to prevent the reoccurrence of your back pain and do things now to prevent it from getting worse later is important. That comes with stretching and exercise. Stretch first. That's the most important thing, because if you jump into exercise, you're more likely to have injuries. Stress management. This is different for everyone, whether it's mindfulness practices or learning what it is that helps you to manage your own stress. It's incredibly important, because the more you feel stressed, the more likely you are to have muscles that are tight, and we're back into that cycle that we talked about. Good nutrition is important, improving body mechanics and ergonomics like we mentioned. And if there's anything else you hear from this slide, it's this one. Exercise is incredibly important to limit the recurrence of back pain. Even if it's just 20 minutes a day, 20 minutes of walking, 20 minutes of swimming, whatever you can do for exercise to prevent back pain long term is important. And you're saying, okay, great, I can exercise, but what do I do? What is the things that I need to do, and what areas do I focus on? The most important areas from a muscle standpoint are your back extensors. So that's things like doing squats, hopefully with just body weight to start. And never overhead. Working on your abdominal core muscles, that's doing sit-ups, planks, whatever you can do to work on the core. And in the legs, it's all about your hip flexors and your hip extensors and all the muscles that support the hip girdle. So if all of these things are not helping, when is it time to go see a physician? When is it time to look for any type of treatment? And I'll run through some of those treatments now. There's pharmacologic treatments. These are medicines that you take by mouth or by injection to help improve the back pain that you're suffering. There's muscle relaxers. These help to treat the spasm and tightness in the muscles, usually related to the initial injury. They are better usually in an acute setting. Acute meaning when you initially have the injury, to help maintain your movement and to limit stiffness, which then limits recurrence of the back pain like we talked about previously. There's anti-inflammatories, things like Advil, ibuprofen over the counter. There are prescription level anti-inflammatories as well, whether it's steroids or non-steroidal anti-inflammatory medicines. These help to decrease inflammation that's caused by the injury. And then there are neuropathic medicines like gabapentin and Lyrica, which help to lessen the irritation and nerve pain caused by a pinched nerve in the spine. But it's important to remember, this is not a long-term cure. It's just a Band-Aid to get us through so that we can increase our activity levels, increase our flexibility, and increase the strength in our supporting muscles of the spine. Oftentimes, physical therapy is kind of the mainstay for recurrent back pain or back pain that lasts longer than 6 weeks. It's important to remember that physical therapy is there to tailor an exercise program and specific treatments to your specific back issue. It's important to remember it's an activity and not a place. It's not a place you go to have work done. It's a place you go to learn what you need to do to improve your own back pain. And you take those activities and those exercises and you take them home. And it's about committing to improving your overall pain issues by committing to doing those exercises on a daily basis. And if all of this is still not helpful, there are injections. There are trigger point injections. This is something that I do in my own clinic to treat recalcitrant muscle spasm and tightness due to the imbalance of the muscles that we talked about previously. There are facet injections and medial branch blocks. These are looking at the pain that's in your back, specifically your back, not pain down the legs. They work to numb and eventually ablate or burn the nerves that are supplying those knuckle joints or the arthritic joints in your spine. And eventually there are what is called a transforaminal epidural steroid injection, or a TFESI for short. That's what the doctors will call it. In that, they take steroid and place that steroid where the nerve leaves the spine to reduce the burning nerve pain that is associated with impingement of that nerve. Any one of these might be a treatment that can help you to get over the back pain that you've been suffering. And hopefully any combination of any of the things that we discussed previously, injections, therapy, and medications, along with altering your lifestyle to improve your own back pain, will be enough to limit the reoccurrence of the pain that you've been experiencing. And hopefully that can limit the need for surgery or greater interventions. It's important to remember that if you are experiencing back pain, we're here to help. Please don't hesitate to reach out or visit us online.